Hi, today for this week we are going to talk about the treatment for an acute sinus infection. So last week we talked about how to distinguish between a uncomplicated viral infection and what we call an acute bacterial sinus infection. Today we're going to talk about the treatment for both an initial sinus infection that might be viral, as well as something that may be a little bit more significant as a bacterial infection. So, as we mentioned, most viral infections are caused by rhinoviruses, and most sinus infections are viral infections. About 85% of them probably a much higher start as a viral infection. In that first couple of days, most people tend to develop a fever and get very congested, potentially start to develop a sinus headache. So for the treatment of that, I recommend alternating every 4 hours Tylenol, and I don't like to take more than 500 milligrams of Tylenol. There isn't any increased benefit of higher doses of Tylenol versus even 325 milligrams. So you want to take the lowest dose of Tylenol that seems to help control your fever, and I alternate that every 4 hours with ibuprofen. If a couple notes, aspirin should not be used in children. It can cause a rare problem called Rye syndrome if you're infected with an influenza virus. And ibuprofen also increases bleeding risk a little bit, so if you're prone to bleeding or get nosebleeds, that's something to be aware of, both ibuprofen and aspirin. Tylenol is not good to take when you're drinking or if you have liver problems, so you should avoid alcohol if you're taking Tylenol. And so those are the mainstays of symptom relief. Decongestants, my favorite to use treatment is really a very steamy shower for about 45 minutes. The heat from a shower makes viral replication a little bit more difficult for rhinoviruses. Rhinoviruses like a colder temperature. And the steam, there's been a study that shows that it at least improves headache. It definitely hydrates the thick mucus that's developing in your middle meatus and clogging that between the lateral nasal wall and the middle meatus, so it helps you blow your nose and get a lot of that thick mucus out that can trap and cause headaches. Afrin I'm not a huge fan of because it is an intranasal decongestant that works really well, but it causes rebound swelling. All the alpha receptors in your nose and maybe a reaction to the preservatives in the Afrin cause your nose to significantly swell. So I really only like Afrin if it's absolutely critical, like you just have a throbbing headache that won't go away. And then if you do use Afrin, no more than once a day for about 3 days. Cough syrups are okay, Dayquil, NyQuil, those are all okay and may give you some symptomatic relief. Now there's a thing to be wary of. If you develop a severe fever, like over 102 degrees, if you develop any eye pain with moving your eyes, or if any parts of your face swell or you get redness on your skin, those are signs that you could be having a much worse bacterial or fungal sinus infection. So those are reasons to go see your doctor. So anything unilateral, so not equal, like it's really throbbing in one particular area of your face, or you're getting some swelling or a high fever, though, for those reasons, go see your doctor. Now, like we were talking about, all viruses use bacteria as part of their life cycle to get out of the body. So over time, there is likely going to be some increased bacterial growth in your sinus cavities following a viral infection. 85% to 90% of the time that clears without any problems, but sometimes that then blossoms into what we call an acute bacterial rhinosinusitis or ABRS. And so for that to occur, typically it occurs where you had a fever and you started getting congested and the fever went away, but then later your fever starts to go up and your face starts to hurt again, or about day 3 to 5 things start to get worse. So if that occurs, our thinking in terms of the medical community has changed. Even if you do get a bacterial sequela to an infection, if you are otherwise healthy and you have good access to doctors and you can get to a hospital or emergency room pretty readily without any difficulty, a lot of doctors are encouraging us to even wait and withhold antibiotics even at the day 7 point. This has changed from the past when we would often initiate antibiotic therapy for people who had symptoms at 7 days. My feelings on that are mixed. I think from a population level that is reasonable. We don't want to give antibiotics too much because eventually it starts killing the good bacteria that live throughout your sinuses and throughout your body, and then make worse bacteria start to colonize your sinuses and your GI system, and makes it harder with every future infection we try to treat. With that being said, I'm the one who sees all the horror stories, so there is a risk of developing severe bacterial problems if you miss a sinus infection. So there's some balance to be had. But if you start to get really yellow or green thick mucus and your fever starts going up and the pressure and pain start getting worse and not better about day 5 to 7, then we do recommend you seek out a doctor, and most doctors will prescribe either guidelines recommend amoxicillin as a first-line therapy. It's a penicillin-based antibiotic, and for people who have had multiple sinus infections in the past or in a high-risk area for resistant bacteria, like they work in a hospital or they're in a daycare setting, which is honestly a huge proportion of people, then we often go to another form of amoxicillin called amoxicillin clavulanic acid, or otherwise known as augmentin, which is a little better at killing bacteria that have some resistance to penicillin. It also causes a lot more diarrhea, unfortunately. So, and maybe 1 in 10 people can get a yeast infection too after that. So antibiotics aren't, benign, but they also treating somebody with antibiotics who definitely does have a bacterial infection reduces the risks of some of the bad problems like an abscess formation, or even worse, cavernous sinus thrombosis, where the infection can spread to your brain and cause a lot of problems. And those occur very rarely, but used to be common problems that DNTs used to deal with before the era of antibiotics started in the 1940s and 50s. If you're allergic to penicillin, then we typically recommend some other antibiotics like doxycycline. If you're allergic to penicillin but can take cephalosporins, the antibiotics that often begin with a C or a K, like Keflex or Omnicef, we then often recommend those antibiotics. One thing that bothers me is a lot of physicians often give people a Z-Pak after a viral infection, because a Z-Pak comes with almost no GI side effects. It's very well tolerated. The problem is a Z-Pak has very low efficacy against the number one bacteria of an acute bacterial infection, which is a bacteria called Streptococcus pneumoniae. And so a Z-Pak kind of is like not a strong antibiotic to actually kill the bacteria that causes most problems. And if you had a viral infection, then you didn't really need an antibiotic to begin with. So I'm not a big fan of primary care doctors giving Z-Paks for acute sinus infections, and much rather prefer my patients get Augmentin. But the one thing is a Z-Pak may be helpful in reducing some of the inflammation and symptoms that come from viral infections. So that's made them very popular for viral infections. I like those for certain patients who need prophylaxis against other types of bacteria, or if they do have overactive immune systems, I will sometimes use azithromycin. But that's basically it. So to repeat, I think steamy showers are probably the most helpful, preventing letting any mucus really plug up any of your sinuses, particularly in the first couple days of an infection. Alternating Tylenol and ibuprofen. And then if you need antibiotics, amoxicillin. If you've never had very many sinus infections and do well with amoxicillin, Augmentin if amoxicillin hasn't worked well for you in the past. And if you're allergic to penicillin, then it's one of the other antibiotics, but those all come with certain problems and risks. Anyway, I hope this was helpful. If you have any questions, please message our clinic. And otherwise, we will hope to hear from you and get feedback on whether this is helpful or not. Thanks so much.